The FDA is debating the next steps in vaccinating America against COVID-19. An independent advisory panel is meeting to discuss whether to approve Moderna and Johnson Johnson booster shots for those who are 18 and older. A new study also finds it is safe for people to get a different booster from the vaccine they initially received. CBS's Skyler Henry has more.
The number of new COVID cases, hospitalizations, and deaths is declining, which the White House says is because of an increase in vaccinations.
Vaccines have been remarkably effective at keeping people out of the hospital and saving their lives.
A new study shows more than 90,000 American deaths since June could have been prevented if they were vaccinated. And the Biden administration is finalizing a mandate that all businesses with more than 100 workers require their employees be vaccinated.
We have to take that lesson and build on it, and ensure that we take the weeks and months ahead to vaccinate as quickly as possible the over 65 million people who remain unvaccinated.
Vaccine mandates are already facing legal challenges. Wednesday, a federal judge in Texas blocked United Airlines from putting unvaccinated workers on leave. While the Biden administration pushes for Americans to get their first vaccine dose, an FDA advisory committee is looking into whether people with the Moderna or Johnson Johnson vaccine need a booster shot.
Over time, there is still relative preservation of the effectiveness of the vaccine against preventing hospitalization, yet there seems to be a decrease over the course of time against overall COVID-19 that was observed.
The group will also look at a new study, which shows people with the one-dose Johnson Johnson vaccine may be better off switching up and getting a booster shot from the Moderna or Pfizer vaccine. Skyler Henry, CBS News, Silver Spring, Maryland.
For more on this, I want to bring in Dr. Kartik Cherabuddi. He's an associate professor of infectious diseases and epidemiologist at the University of Florida. Dr. Cherabuddi, welcome. Great to see you. So, good news, new COVID cases, hospitalizations, and deaths are down. Does this indicate that vaccine mandates are working?
In many ways, they seem to be effective. In places that have come in with a requirement, they seem to be helping. I think this starts from the first place, right? That the vaccines are safe and effective, and they keep you and people around you safe, and therefore creates a safe work environment. And from that standpoint, the requirement is helping because people are no longer putting the vaccination away. With so much misinformation and noise, it was leading to people putting off vaccination for a while. And then with a requirement that's breaking through and letting people get vaccinated. The one thing, though, that's crucial along with this is that each employer, county, or state also have education about the vaccine to prevent or minimize friction. In that way, it's really effective.
So, speaking of effective, do we know how effective booster shots are yet? And do you have any concerns about mixing and matching the vaccines? I mean, I got my second dose in April. I'm counting the months, wondering if I'm going to need, a booster in the coming months. So what are your thoughts on that?
Yeah, it's a good question. I think to follow the evidence, honestly, is the elderly and those with major risk factors, what happens is their own innate immune system is slow to react. And their adaptive system, which includes the T cells and B cells, is not as good as with younger, healthier people. So I think it makes sense to have boosters for those folks especially. I think it's important to get them in. Those who are immunocompromised, get them in to get boosters as well. People who work in healthcare and other areas, I think it's reasonable to get the booster. In younger family members of mine, and my patients are asking me the same question, I think it's really looking at your own personal risks and not to just lay it out as talking to your doctor, but this is where there is not a strong evidence that boosters are immediately needed in otherwise young, healthy people. I think dose 1 and dose 2 are crucial. The booster, maybe if you're young and healthy, but for the elderly, I think it's required. And then the mixing and matching, it's really good to see, right? There were lots of people who got the J&J vaccine. We asked them to get the earliest vaccine they can get their hands on, and they did. And we didn't have clear answers for them. I think this new study, which shows mixing and matching helps, it produces a robust response, even if you get an mRNA vaccine after the J&J vaccine, for example, similar to what we saw with AstraZeneca boosted with one of these vaccines. The J&J is showing great benefit by giving the second dose with Pfizer or Moderna. I would caution that we don't read too much into. Yes, go ahead.
No, I was just going to say that must make health officials pleased, because it makes it a little bit easier if you can mix and match. Correct?
It does make it easier. If you, especially for those folks where you might not have the second same vaccine available, or they had a side effect which you might not have with the other vaccine, or you had an allergic reaction, the same ingredients are not present in the other vaccines. So it's a big benefit for physicians' offices, for health communicators, for governments. It gives us more access to giving people safe and effective vaccines. I'm happy with this news, and a lot of people I know are happy as well. I think this is going the right way.
And quickly, before we let you go, Doctor, health officials are also reporting fewer COVID-19 infections in your home state of Florida. More good news. We know the state has faced tough criticism for its response to the pandemic. So why do you believe there are fewer cases now?
I think the most mobile populations have either gotten vaccinated or infected, which buys us a significant time of immunity. The natural infection immunity is not as robust as the vaccine, but prevents you from ongoing transmissions and the wave going further. I still think if you've had the infection with COVID, you should still get at least one dose of vaccine, if not two, to prevent these cases from coming back during the holidays. But for now, I think it's just infection plus vaccination that sort of led to these cases going down in Florida. Not as much to do with protective measures.
Doctor, that's important. I just want to reemphasize that point you just made, because a lot of people question whether they need a vaccine if they've already been infected with COVID-19. And you're saying it is helpful to get at least one shot, even if you've already recovered from COVID, correct?
Yes, we now have very strong, good data. A number of my colleagues and family members have had COVID very early in the pandemic and then got vaccinated. They definitely have better protection. We've seen this in twins. We've seen this in other people, family members who got infected and natural immunity. We clearly have seen better effects down the road with those who've been vaccinated. So please get vaccinated. It's safe, even if you've been infected.
Dr. Kartik Cherabuddi, thank you so much for joining us. As always, we appreciate your expertise.
Thank you for having me.